Healthcare is very dependent on immigration. And when they couldn't get it back in 20 and 21, going into 22, we saw staffing postings for travel nurses went crazy because people couldn't get their labor supply. We're looking at 1 out of every 5 of our nurses, 1 out of every 4 of our health aides. States like New York, New Jersey, I live in Florida, 1 out of every 4 of our nurses, 1 out of every 3 of our doctors, 1 out of every 2 of our health aides were foreign born. And so in 20 and 21 and going into 22, we were having a lot of problem processing visas. The labor supply was cut off. Therefore, I couldn't get my labor pool. So I come after your labor pool. Travel nurses explode. Then immigration finally loosens up. We see these postings going back down. But what's very interesting is they're going back up again. When we look at the state of healthcare, we can see that postings are 4 times higher now than they were prior to the pandemic. And believe it or not, prior to the pandemic, they were actually fairly flat, growing very, very slowly. But we are seeing an explosion in postings. I meet with hospitals more than I meet with any companies. And the hospitals that I've talked to are all building new hospitals, all of them. They are doing it even though they can't staff their current hospitals. They're building new hospitals. So this is an area that people are going to desperately have need.